Welcome to Housing and Healing, a podcast about homelessness here in Denton, Texas. My name is Alice, and you'll soon be hearing from my colleagues Hope, Ciara, Danny, Kiasha, and Daisha. We're a group of social work graduate students raising awareness about issues affecting our community. We'll each be detailing different aspects of the experiences of the unhoused community here in Denton, paying special attention to the members of this population with disabilities. In this podcast, you'll hear about interviews we conducted with several members of this community, service providers, and grant writers for a holistic perspective on this complex and often misunderstood issue. First, we'll take a look at some common misconceptions that affect how people view this population. When the topic of homelessness is brought up, many people are quick to recite talking points fueled by stigma, like they should just get a job. In reality, these members of our community face numerous barriers to employment, like lack of transportation, lack of IDs or other necessary documents, and the lack of a permanent address. Additionally, without access to showers, professional clothing, laundry services, necessary medications, it's more difficult for them to maintain employment long term. These issues are compounded for those with disabilities as employment discrimination and further barriers accessing transportation. People often assume that people experiencing homelessness are drug users and that usage is caused by their homelessness, or the usage has caused their homelessness. This is incorrect and stigmatizing. There are many causes of homelessness, and most commonly, loss of employment, domestic violence, and mounting debt. Oftentimes, drug use is something that begins after an individual becomes homeless. One cannot overstate the anxiety and discomfort of life without a suitable shelter. Because of these harsh conditions, self-medication becomes one of the only options for relief, especially when these individuals lose access to prescription medications. People experiencing homelessness are also often assumed to be criminals or even violent based on their housing status. In actuality, people experiencing homelessness are far more likely to be the victims of crime and violence rather than the perpetrators. Some of this violence is even perpetrated by law enforcement agents. With rising costs of living, dismal job market, and increasing economic volatility, any of us could find ourselves in a situation that, like some of our interviewees. In your interviews and experiences with this population, how often have you seen individuals impacted by these stigmatizing societal assumptions?
All right, Alice, I would love to answer that. So, just to let you guys know, my name's Hope. In my experience, I've seen many individuals deeply affected by stigma, especially those who are both unhoused and living with a disability. So, at Our Daily Bread, which, if you guys do not know, it is a homeless shelter that is in Denton County. I used to be an intern here, so I kind of know a lot of the experiences that people had here and just more about that. But for example, here, there's a designated area where people with disabilities will sit, and I've actually heard other guests make judgments about them. So in some cases, the harshest stigma doesn't always come from society at large, but it can come from peers as well. So just really hearing the voices of others, I think, is really important. And I'm going to talk more about this during my section, which will be right after answering this question. There's always this assumption that people with disabilities can't do anything or are completely incapable of working, when in reality, their disability doesn't define their abilities or potential. Unhoused individuals face stigma on so many levels, from the broader community, from systems that are supposed to support them, and sometimes even from the staff and other guests within the organizations designed to help. At ODB specifically, there's only one social worker on staff, which shows just how great the need is for more mental health professionals, especially for vulnerable populations who are dealing with layers of stigma and additional barriers every single day. So, to get into this, I conducted 4 interviews at Our Daily Bread, and I'm just going to go over them and share each one of the interviews that have happened and just really get that qualitative research out there for people to see and be able to hear from the voices of this vulnerable population, because we think it's very important. I originally had an ROI set for these guests, release of information, just to ensure about confidentiality purposes. But since in here I'm not going to be stating anybody's names or anything like that, I did not need that, but I just wanted to make that clear. So I'm just going to go over interview one first. This first participant described experiencing high levels of psychological stress resulting from both his disability and the instability of his housing situation. He emphasized that his anxiety intensified when he first arrived at the shelter due to unanswered questions and the constant exposure to other stress and emotions. Formerly independent and employed, he now struggles with a sense of lost autonomy and financial burden following severe back and hip injuries sustained in a fall. He reflected on the stigma associated with disability, noting that people mistakenly assume that physical disabilities imply mental incapacity. He expressed frustration with being generalized as just another homeless person, emphasizing the importance of personal connection and empathy. He believes that improved staff training and greater awareness could help reduce stigma and promote a more person centered approach within the homeless services. So that's the first interview that I did. As for the second one, the second participant was a woman who lost her job in housing following an injury. And this participant, I actually did her intake, so I was able to already know a lot of her situation and what she's been through, which I also think is really important for us to know. Um, so she discussed the physical and emotional toll on managing multiple health issues, including a previous stroke, heart complications, and neuropathy. Living without family support, she faces isolation but has developed coping strategies centered on maintaining peace, kindness, and stability in health. She feels judged sometimes, particularly by other residents who do not understand why she cannot work, yet appreciates the assistance offered by shelter staff. Her account highlights the social isolation and peer level misunderstanding that often accompany visible and invisible disabilities. Despite limited support networks, she has cultivated personal resilience through self regulation and avoidance of conflict to preserve her well being. I noticed during my time here, she particularly tried to stay to herself and all that. And it's unfortunate that some of the reasons why was just because she didn't want any to start anything and risk her stay at the shelter or anything like that. All right, now on to the third interview. So, the third participant reported having experienced 2 strokes and 3 heart attacks in the past 2 months. He expressed deep frustration with the shelter environment, describing it as ineffective and unreliable. According to him, communication and follow through from staff were inconsistent, and he felt that his request for medication and healthcare assistance went largely unaddressed. His narrative revealed strong feelings of mistrust toward both staff and service providers, such as MHMR, whom he felt dismissed his needs. He called for greater accountability and action from shelter personnel, emphasizing that action speaks louder than words. All right, and as for the last interview, interview 4, the fourth participant lost his leg, now uses a wheelchair. He described the ongoing stress of uncertainty, particularly the fear of not having a guaranteed bed each week, though recent policy changes have provided him with temporary stability. He shared feelings of invisibility and discrimination, explaining that many people treat him as though he is incapable or unworthy of engagement. Formerly, he was a restaurant cook. He struggles with the transition from an active working life to dependency on institutional systems. He also noted favoritism among staff, which he feels undermines fairness and morale. Despite these challenges, he stressed that he remains capable and motivated, wishing to be seen and treated as an equal member of the community. All right, so I thought it was important during this time to really collect common themes that I noticed throughout all interviews. And across all four interviews, participants emphasized the compounded challenges of disability and housing instability. Each individual reported elevated stress levels, frequently describing the shelter environment as emotionally taxing and, at times, unsupportive. Common themes included the stigma associated with disability, feelings of invisibility or judgment, and the inadequacy of institutional support systems. While some participants acknowledged the efforts of staff members, others expressed frustration at perceived inaction or inconsistency in assistance. Despite these hardships, several interviewees highlighted resilience and mutual support among residents. Many expressed a strong desire to be recognized as capable individuals rather than defined by their disabilities or housing status. Collectively, their accounts underscore the ethical importance of empathy, awareness, and systematic reform in addressing the intersection of disability and homelessness. There is a need for empathy, follow through, and individualized care between all the interviews that were conducted. And I just really want to ask some discussion questions to you guys about first one being, when disabilities feel invisible, what moral obligations do we as a society have to ensure they are seen and heard?
Hi, this is Sierra. Thank you for sharing, Hope. That's actually a really good question. I think in social work, medicine, therapist settings, and all human centered professions or areas of work, we hold a moral responsibility to honor each person's dignity and acknowledge their unique challenges. This is especially true for individuals experiencing homelessness, whose needs are often overlooked and whose presence is frequently ignored. This is seen often on the streets where people simply, walk past individuals experiencing homelessness without even acknowledging their presence, acting as if they are not there at all. This avoidance reinforces that invisibility and dehumanization, particularly for those people with disabilities who already face significant societal barriers. For people with disabilities, this invisibility is especially common when their disabilities intersect with the hardships of homelessness. And as a society, we must do better. We need to do better with ensuring that they are seen, heard, and treated with the respect and care every human being needs.
Awesome. Thank you for that, Sierra. I think that's a very good outlook. All right, I have another question for you guys. One theme was the stigma that disabled and unhoused individuals experience from both the public and peers. Where do you think stigma originates, and how can education help dismantle it?
I hope. I think this is a really good question. And I'm Danny. And I personally feel as if the stigma comes the fear of the situation happening to you or someone you know. People can't imagine themselves as reaching such a low point in their life that they associate homelessness with a personal failure and not as a combination of issues that include systemic failure. I think education can not only provide insight into what those systemic failures can look like, but also engaging with one's community through volunteering or even just listening to stories about those that are experiencing homelessness can generate empathy. During the interview I conducted, the caseworker and I had a brief conversation after the question I had asked her about just how easy it is to become homeless and how devastating the systems in place to support this population are. There often isn't extra funding set aside to support people right away when they reach the point of homelessness, and shelters often reach a max capacity. And the caseworker I interviewed said it becomes difficult to turn people away in inclement weather, which is when they see a large turnout. Especially in the case of individuals who are disabled, there are many barriers to accommodate disabilities. Everyone, maybe except those with exorbitant amounts of wealth, is one medical issue, one natural disaster, one house fire, one death in the family, one divorce, and so many more situations away from losing everything and becoming homeless, seeing themselves on the street or in a shelter. A big misconception is that homeless individuals are lazy or that they're drug addicts, but I think a lot about a family I worked with during my internship who did not fit any of these stereotypes, yet still found themselves in the same situation. If it's okay, I'd like to briefly share that story to highlight how unfortunately simple it is to fall into such hard times. And I won't give any details, of course, um, to protect their privacy, but it did begin with a house fire. They lost most of their personal belongings and important documents because of an issue with, I believe it was electrical wiring or something of that sort. They moved in with the dad's brother while they were figuring things out. A couple months later, the brother passes away in an accident. They can't keep up with the bills for the brother's house. They then move into the brother's RV. It gets broken into. What little they had gets stolen. At the point they reached out to my supervisor for housing assistance, 2 adults and 3 kids were living out of a minivan, completely out of their control. Just a very difficult cycle of circumstances. And luckily, we were able to provide them resources, but it should not have gotten that far before they received help. I also want to add that even if an individual does fit the stereotype of what a homeless person may look like to people that stigmatize it, such as being addicted to drugs, I think humanity and dignity is still owed to this person while they are struggling through hardships. So in short, I hope I answered your question, but education and empathy can do so much to support people in multiple aspects and help dismantle the stigma. And we can also learn a lot about resilience from these individuals. Thanks again, Hope.
Thank you, Danny, for that. I really like that you personalized that and brought an experience that you saw firsthand. Me being at ODB, I saw this happen too. One of the guys there that I did an intake of, he had a natural disaster happen, a tornado, and it destroyed his house, and he was just brought through some really unfortunate circumstances, and that reminded me of what you just said. I have one last question that I want to address to you guys. What do you think these stories reveal about resilience and the human capacity to maintain hope in amid structural inequality?
I'll take that one, Hope. I've also worked with these populations quite a bit, and I've heard so many stories like the ones you've just heard. People who had stability, jobs, and housing get dealt a very difficult set of circumstances and end up losing everything surprisingly quickly. While I agree these individuals and their families are powerfully resilient, they really have no other option. Folks like Danny and Hope just described fight and struggle every day to survive and provide for their families. They turn to our local resource network for hope of finding their footing in society again, and sometimes are disappointed by the amount of help available. While these organizations have transformed the circumstances for many individuals and families, there's unfortunately far more demand than supply. We as a community need to do more to bolster our community resources and make them more able to bridge service gaps and fill the needs of our most vulnerable community members.
Thank you for sharing, Alice. On that topic of community resources, I set out to attend a Homelessness Coalition of Denton County meeting to find out a little bit more about the community resources. And these meetings rotate between the Denton and Frisco or Louisville locations. And the DCHC is a collaborative network made up of nonprofit agencies, city representatives, school districts, and a few other community stakeholders. Its purpose is to connect resources, support innovation, and strengthen services for people experiencing homelessness in the community. The coalition partners with the Texas Homeless Network, and it also coordinates funding opportunities such as the Emergency Solutions Grant, and works closely with groups like Denton County Homeless Leadership Team. And the coalition reviews goals, identifies service gaps, and updates priorities for the community. United Way is one of the organizations involved in this network, helping coordinate community resources and supporting homeless services across Denton County. And when I attempted to attend the meeting in October, I discovered there wasn't a traditional meeting that month. After being unable to locate the meeting, I stopped by United Way just to get more info. And there I was informed that they were holding a kind of mixer or awards event away from the regular meeting locations. But there is where I met Olivia Mata Williams. She is the Chief Program Officer at United Way at the Denton location. She had just returned from the event, and she spent some time talking with me about her role and her team's work with the houseless population, which provided me with helpful context even though I wasn't able to attend the meeting itself. She organizes the Denton County nonprofit Covenant and contributes to both the community needs assessment and legislative advocacy teams. And when I brought up mental health within the homeless population, she emphasized the unhoused population is a transient population. There are a variety of issues and concerns, and not only from a behavioral or a mental health perspective, but the physical health as well. She gave the hypothetical, but like a very real example of an unhoused diabetic individual, one whose blood sugar is unregulated, and this could be for a variety of reasons as well. Low or high blood sugar can directly affect a person's mood, behavior, or cognitive functioning. Cases like that example show that within the houseless population, there are unique needs that reflect overlapping challenges and, with that, service access barriers. And then with this, she pointed out that for many without stable housing, something as simple as storing medication can become incredibly difficult. Mental and physical health challenges interact in ways that create concurring risks among the houseless population. She explained that even when conditions are treatable or quickly fixed in a clinical setting, it's the lack of secure or long-term stability that leads many of these individuals to fall back into crisis. And there's also, of course, just general mental health symptoms being extremely hard to manage when you don't have a safe place to rest, consistent food access, or even transportation to appointments. Olivia also pointed out that Denton County is working to expand mental health resources such as mobile crisis response teams. However, capacity is, of course, tied to funding. And Kaisha and Deja will discuss funding here in a bit, but basically, more funding means more outreach and more sustained impact. Expanding mental health access and mobile crisis response teams seems like a good start. And with this, another important theme she raised was self-determination. Even when services are available, individuals must be ready and willing to engage with them. And many people experiencing homelessness may struggle to adhere to treatment plans for a variety of reasons. Oftentimes, this is not because they don't want the help, but because, of course, some basic needs come first, like safety and food. Without these, treatment becomes secondary. She explained that UVH and MHMR, the Homeless Coalition, everything in Denton County gets done through collaboration to achieve collective impact, to progress social initiatives, with the overall goal of making homelessness rare, brief, and non-reoccurring. This conversation provided a lot of insight into the interconnecting barriers among the houseless population, especially when it comes to accessing and maintaining mental health care needs. And it also highlighted the importance of Denton County's collective impact model, which brings multiple agencies and organizations and nonprofits to the table. Even though we didn't dive too deeply into the model itself, what stood out is the collaboration really being the backbone of this approach. No single organization can address homelessness alone, and Denton County is intentionally working across sectors to fill service gaps and streamline care to make meaningful progress through shared responsibility. And lastly, I also wanted to mention the Denton County Homeless Coalition meetings again, because although that month I tried to attend one, that was an exception due to that event they were having. Normally, their meetings take place once a month and they are open to the public. The meeting locations rotate one month in Denton and the next in Frisco or Louisville areas. For any aspiring social workers, current students, or anyone in the community who is interested in homeless advocacy, I highly recommend attending. It is a good opportunity to learn more about these topics, to network, and to observe how collaboration actually happens at that community level. And a discussion question I would like to bring up: what is the biggest misconception the public has about mental health or mental illness and the connection it has to homelessness?
It's Kiasha, so I'll be answering her question. From what I have personally seen and heard, obviously this is my perspective, one of the major misconceptions about mental health and homelessness is that people think mental illness automatically causes homelessness. I think a lot of people assume that every person experiencing homelessness has a severe mental health condition, or that their situation is only the result of mental illness. In reality, homelessness is the result of many overlapping factors, such as affordable housing, unemployment, family conflict, trauma, and systemic barriers. Mental health challenges can definitely make things harder, but it's not fair or accurate to say that it's a sole cause. Another misconception I've noticed is that people believe individuals who are homeless don't want help or aren't trying. From what I've seen, many people are trying incredibly hard, though for me, the biggest misconception is oversimplifying the issue. It's not mental illness equals homelessness, it's a complex mix of personal, social, and structural factors, and each person's story is different.
Those were all really good points, Kiasha. I'll go into my part next. My name is Daniel, and I did have the opportunity to speak with a case management specialist who works at the Carpe Collins Social Service Center in Dallas, which is one of the largest Salvation Armies in the country, as their specific shelter can house up to 430 clients and up to 600 inclement weather. And although we are focusing primarily in homelessness in the Denton area, it was important to highlight this location as the shelter in Denton cannot house as many people, and many of the homeless individuals travel to this specific location to seek support. And in my interview, we discussed the barriers to mental health treatment, public housing support for those with disabilities, how easy it is to become homeless, which we've covered a little bit earlier, and the comorbidity of disability with homelessness. The person I interviewed holds a clinical license and works specifically with homeless individuals who need mental health and substance use treatment and are seeking medical respite. So I'm very glad I had the chance to speak with her. I'll do a short debrief of the questions I asked her and what she had to say. So first, I asked her to describe some of the challenges related to mental health that she sees in clients. Mental health and the state of being homeless intersects in almost every case at some point down the line of working with clients. Despite how common it is, though, the biggest barrier for these clients to receive treatment is funding. Most of the clients aren't going to have insurance. That is not on their list of items to look out for. It's going to be basic needs like food, warmth, clothes, and shelter, of course. Since it's hard to access treatment, what they can access isn't always the best, and it's very limited. It can be short therapy sessions with a clinician whom they may not even see again or on a consistent basis. And there's often substance use alongside the mental health issues. She told me that she often sees unsafe behaviors, and she does not fault them for this because they are in such a difficult situation where so many emotions are running high. But when these behaviors are displayed, they can lose their place in the shelter. And it does hurt to have to ask them to leave because there truly is nowhere else for them to go. But they need to keep everyone else in the shelter safe too. It becomes an issue of weighing the issues against each other and taking a utilitarian approach, fortunately. I then asked her specifically about disabled individuals, if they face greater obstacles than those without disabilities when they seek housing support. I got a little bit more good news at this part because public housing support for individuals who are disabled and homeless is pretty accessible. And most clients in this shelter go through PSH, the public housing support, and it means that in theory, the government will pay rent for them for the rest of their lives. But the wait list, as you can imagine, is extremely long. She shares that there are currently 3,000 people on that list at the shelter she works at. And this is when it gets difficult again because there are a lot of boxes to check off to qualify. Clients with disabilities may take longer to find housing through these systems due to going to specific channels to, I believe, evaluate what accommodations they'll need and to assess their medical history too. Clients with able bodies, though, and if they're able to work, it's easier to get them housed versus those who can't contribute to the rent alongside the government funding for the housing. Lots of systemic issues with government funding and housing support because they prefer those who can contribute, and the funding for everyone just is not available. In my third question, I asked her what volunteers or social work students should be aware of when working with the homeless population, and what are common misconceptions she has been aware of. This is when we talked about the stigma that society holds against this population. Anyone can become homeless at any time in their life. No one is immune to it, essentially. Most, if not all, of the clients that she works with have a very low self-worth. She sees people from all races, ages, genders, and backgrounds come in for housing needs, and it is absolutely not a moral failing. She shared that she has clients who have master's degrees. Some had long-time jobs. For example, one of her clients was an electrical engineer for most of his life. The right combination of issues can happen and you can lose everything. These individuals are not less than, and they're going through a hard time. They are not giving you a hard time, though. At the shelter, they most often use a trauma-informed care approach, which helps social workers and helping professionals alike to understand and respond to the impact a trauma has on an individual's physical and emotional safety. At this point in the interview, nearing the end, she explained to me that there wasn't one disability, whether mental or physical, that impacts the help that individuals need. There will often always be comorbidities in the clients that come in, especially since she works in medical respite. People come in under a lot of stress, injured, and traumatized. Several amputees come in, and others with severe wounds or infections, and they are in need of medical care right away. 40% of the adults that come in are diabetic, which is more than the national average. I believe when I looked it up, in the United States, about 38% of adults have diabetes. So in the shelter, this number is astounding. But although there are several issues to address with each client, the social services team at this Salvation Army work hard to tackle it from all angles. Because these individuals want to work towards housing first and foremost, but they also need to work on getting sober or getting treatment for mental or physical needs as well. She explained to me that the steps they take to assist these individuals look like getting them into the shelter and giving them food, assessing what they're looking for in regard to housing support, what medical needs should be addressed, getting them their paperwork or other necessary documents, like an ID, for example, and then finding out if PHS, public housing support, or other avenues are available. At the end of her conversation, she wanted to emphasize that this is not an easy process, especially when a shelter has over 400 people. It takes a long time to even get the process started. And honestly, just being nice to these individuals that come in can be a tremendous help. And I know I covered a lot of information in this section, but I do think hearing from a caseworker that sees these individuals and the range of situations that each person comes from is very valuable information for myself as a social work master's student, and even just as someone who wants to know more about the homeless population and those with disabilities. I'd like to discuss something that I've been thinking about since this interview, though. The person I interviewed brought up that a big and emerging issue is the barrier of immigration status. Do you guys know what kind of changes have been made with immigration, or do y'all have any thoughts on what specific barriers this may create?
This is Deja. Yeah, I think you brought up a good point about immigration status being a barrier. It's really important and honestly something we don't talk about enough in social services. Recently, a lot of changes in both federal and state policies have made it harder for undocumented individuals or mixed status families to access resources. A lot of housing programs, disability services, and even health coverage require proof of citizenship. So even if someone is experiencing homelessness or living with a disability, their immigration status can immediately disqualify them from getting help. Another big barrier is fear. Many undocumented individuals avoid seeking services because they're scared of their information might be shared with immigration enforcement. Even when a program is technically safe to access, that fear alone can stop people from reaching out. On top of that, documentation requirements like IDs, work permits, or social security numbers create a roadblock that makes it hard to apply for benefits or stable housing. So when you put all of that together, immigration status becomes a major layer of vulnerability. It creates gaps in care, increases instability, and puts people at a higher risk of long-term homelessness. As a future social workers, I think it's important that we understand these structural barriers so we're not just treating symptoms, but also recognizing why certain groups are being left out in the first place. And honestly, hearing about barriers like immigration status really ties into how
complainant and underfunded the whole system is. It made me think back to the interview I recently did because of a lot of the issues overlap. So I want to shift into what I learned from talking with someone who worked directly with funding and housing resources, since that conversation really opened my eyes to what's going on behind the scenes. Me and Kiasha recently interviewed with someone who works hands-on with grant making and housing resources. The things that she shared really changed how I look at the system. I want to walk you through my biggest takeaways from that conversation because these are the things that we don't talk about enough or at all. One of the first things she shared with us was that mental health support receives almost no meaningful funding, especially compared to other areas. She explained that most public money goes towards shelters or substance use treatment programs, which are important, but they're not enough on their own. Mental health ends up being pushed to the background and treated like an opportunity or additional add-on rather than a core part of helping people move towards stability. She told us that the system is designed to meet immediate survival needs, giving people a bed for the night or a temporary place to stay, but it's not designed to actually help people recover emotionally or mentally. Housing without mental health care is basically setting someone up to repeat the same crisis over and over again. Many people experiencing homelessness are dealing with trauma, untreated mental illness, grief, stress, or long-term emotional challenges. Without mental health support, they're not even being given the tools to break the cycle. Another point she made that is when mental health programs do get funding, it's usually short-term or extremely limited. There might be a program that lasts a few months or only offers a handful of sessions that doesn't really help someone build the long-term trusting or stable relationship needed for real healing. Mental health care has to be consistent to make a difference, not something temporary that disappears when a grant runs out. She talked about how shelters themselves create barriers to help people from accessing mental health care. Many shelters have strict rules, time limits, and overwhelming environments. People might have to leave early in the morning, wait in long lines, or follow rules that don't take account for their mental health symptoms. Because of these rules, people often leave the shelter systems quickly, long before they ever get connected to the mental health professionals. So even if a shelter technically offers mental health services, many people never stay long enough to receive them. She said that way funding is disputed shows what society values. If mental health support keeps ending up at the bottom of the list, that tells us that emotional well-being isn't seen as essential, even though it's one of the biggest factors in helping someone exit homelessness permanently. Explained that physical accessibility is a huge barrier. Some shelters don't have ramps, elevators, or bathrooms that people with mobility impairments can use. Many shelters require people to stand in long lines outdoors, move around crowded spaces, or climb stairs, all of which are impossible for some individuals. Even when shelters are technically ADA compliant, they often fall short in practice with narrow hallways, heavy doors, or bunk beds that a person with mobile issues cannot safely use. But the accessibility problems don't stop at physical disabilities. She emphasized that people with intellectual disabilities or cognitive challenges face even more barriers. Many programs require people to fill out complicated forms, navigate long processes, remember appointments, or follow strict rules, all without offering accommodations. Someone who processes information differently may be seen as non-compliant, and when reality, the system just wasn't set up to support them. She also shared that people with mental health-related disabilities face deep stigma. If someone is experiencing paranoia, anxiety, or symptoms of psychosis, they might be misunderstood or labeled as difficult. Instead of receiving support, they may be asked to leave the shelter or denied services. She made it clear that the entire system often assumes that everyone can think, move, communicate, and behave the same way, and that simply isn't true. Because of this, many people with disabilities end up avoiding shelters altogether. They fall through the cracks because the system wasn't built with them in mind.
Deja has made some great points. Going off the same interview, one of the most powerful parts of our conversation was in discussing the common misconceptions people have about homelessness. She said these assumptions shape not only public opinion but also policies and funding decisions. She explained that many people, including some who work in helping professions, still believe that the homelessness is a result of personal failure. There's a widespread idea that people choose homelessness or that it only happens when someone makes repeated bad mistakes. She emphasized how damaging this mindset is because it shifts the blame onto the individual instead of looking at the larger systemic issues like lack of affordable housing, untreated mental illnesses, disability discriminations, and generational poverty. She also said that many people believe homelessness could never happen to them, but she reminded us that most people are one major crisis, such as losing a job, facing a medical emergency, experiencing domestic violence, or dealing with a mental health breakdown, away from losing the stability. It's much more common and people realize. She mentioned that in Denton specifically, there's a belief that people experiencing homelessness come here for free resources. Statements like, "my tax dollars are paying for the homelessness," creates resentment and feeds harmful stereotypes. But in reality, people experiencing homelessness are not using the system for handouts. They're looking for basic human necessities like safety, stability, and dignity. She also talked about how assumptions can shape the way the public expects the system to respond. If people believe homelessness is a personal failure, they support punishment instead of support. They support policies instead of social services, and those assumptions reinforce a cycle where people experiencing homelessness feel judged, looked down on, and unwelcome in their own community. When asked what needs to change, she didn't hesitate. She said that the entire approach to homelessness needs to shift away from criminalization and towards compassion, accessibility, and long-term support. One of the first things she said is that the police should not be the first responders to homelessness. Police involvement often creates fear, leading to the breaking of encampments and increasing the feelings of being criminalized. People end up losing their belongings, their community, and their sense of safety. She believes trained crisis response teams, social workers, mental health professionals, and peer support workers should respond instead. These teams know how to de-escalate situations, build trust, and connect people to the right resources. She also said that the community needs 24-hour shelters, especially during extreme weather. Having shelter that's close for part of the day leaves people vulnerable to dangerous temperatures, storms, or unsafe environments. A true safety net has to be accessible at all times, not only during convenient times. Long-term mental health support was another major point she emphasized. She said we cannot keep offering short-term services that end just as a person begins to trust the provider. Mental health care must be continuous and stable if we want people to heal and move forward. Finally, she talked about funding, the way money is distributed ineffective and inconsistently. Money goes repeatedly to the same organizations year after year, but there's also pressure to fund new programs for the sake of innovation. This constant shifting spreads resources thin. Programs struggle to stay open long enough to make an impact. She said the systems need long-term investments, improving solutions, and not quick fixes. Her overall message was that if we want meaningful change, we need consistency, compassion, and community-based support, not punishment and short-term thinking. Something she kept bringing up was how mental health barely gets funded and how shelters aren't really set up to support people long-term. I'm curious, have you all seen this? Or do you think the way funding is prioritized affects whether people can actually get stability?
Absolutely. Funding prioritization very directly affects this population and how our community resources ability to help them achieve stability. Each dollar that goes into organizations like Our Daily Bread or Denton County MHMR funds direct services and personnel to provide those direct services. Mental health services are vital to this population, but are so often out of reach due to financial and transportation issues. Thankfully, these two organizations and many others work together to help bridge gaps in services and increase the odds of these individuals gaining access to necessary resources, even housing. Throughout this podcast, you've heard a broad set of perspectives discussing issues impacting one of the most vulnerable populations in our community. This community faces judgment, discrimination, exclusion, and lack of suitable resources at every turn. While there are amazing efforts by local organizations to help this population, funding is scarce and community action is needed. We encourage everyone who is listening this far to get involved with helping this disenfranchised and growing community. Our local shelters here in Denton are always accepting volunteers and donations. You can get more information about Our Daily Bread at ourdailybreaddenton.org and Our Daily Bread Denton on social media, and Salvation Army at salvationarmyntx, as in North Texas.org. Additionally, the Denton County Homeless Coalition can be found at Denton County Homeless Coalition on social media and endhomelessnessdenton.org. One amazing way to get involved that I and another member of this podcast has done is volunteer for the annual Point in Time Count coming up on Thursday, January 22nd, 2026. The Point in Time Count, also known as the PIT Count, is conducted to collect data on the number of individuals experiencing homelessness here in Denton County and affects how much funding the Department of Housing and Urban Development gives our local resources. They also use the pit count as an opportunity to distribute helpful supplies like gloves, hats, hand warmers, and bus vouchers.